CBD products are generally safe to consume, and the vast majority of individuals can ingest CBD oil without experiencing any unpleasant side effects. When it comes to side effects from oral CBD consumption, symptoms might include lightheadedness, dry mouth and drowsiness. The FDA-approved CBD product Epidiolex has also been linked to changes in appetite, vomiting and nausea, as well as diarrhea. Many of these side effects are mild compared to most prescription drugs used every day. Let's go over what they are and how they may affect your body. The use of CBD can cause what is called cotton mouth. This dry mouth effect seems to be a result of CBD's interaction with the CB receptors in the mouth known as submandibular glands. Consequently, this interaction has a tendency to reduce saliva production. Drinking a healthy amount of water before and after consuming CBD oil can help avoid this side reaction. CBD can affect the sleep cycle. In fact, high doses of CBD can induce drowsiness. Paradoxically, it has also been demonstrated in clinical research to be a wake-inducing agent. In high doses, CBD is believed to affect blood pressure. Typically, it has been observed to lower blood pressure within a few minutes after entering the body. This can lead to a temporary lightheaded feeling when standing too quickly. CBD can also inhibit hepatic drug metabolism, which is responsible for breaking down most pharmaceutical drugs. To be more precise, CBD temporarily neutralizes the enzyme cytochrome P450. Diarrhea is considered another potential side effect of CBD. However, this reaction is most likely caused by other ingredients in CBD items. Research studies revealed that two potential reasons for diarrhea are improper dosage and CBD carrier oils. In fact, it is possible that other compounds in CBD products can contribute to gastrointestinal distress. Coconut oil and MCT oil are frequently utilized as carrier oils in commercial CBD items. They have been found to cause diarrhea and loose stool in those individuals who are not used to taking it. If a consumer is experiencing this side reaction, it is advised to stop taking CBD for 24 hours immediately. Such a time frame is necessary to see whether CBD or any other item caused this. In general, higher doses of CBD can occasionally result in fatigue or drowsiness. This side reaction was identified by studies that tried to explore CBD's effects on sleep. Verified by data, high doses of CBD helped consumers increase sleeping time. However, some consumers reported feeling tired after the exposure. Consequently, healthcare professionals do not recommend taking CBD oil before or while driving. There may also be some potentially adverse side reactions from different vaporizer additives and products. Some CBD brands use artificial flavorings that contain chemicals which, although are labeled, generally recognized as safe, by FDA, might cause certain side effects. It's important to note that this applies exclusively to oral methods of CBD consumption. Vegetable glycerin is a common ingredient in most CBD vape juices that can cause an allergic reaction. It can cause individuals to suffer from dizziness, shortness of breath, and nausea. As with vegetable glycerin, propylene glycol is also generally recognized as safe, but consumers may still experience an allergic reaction. When applied to the skin, CBD is not risk-free. Most people who use CBD topical cream do not have any side effects. However, sometimes an allergic reaction can take place. This could be due to any number of environmental factors. Stick to a proper dosage to avoid side effects. Several side effects may be caused by the incorrect dosage of CBD oil. Depending on the reason why a person is taking CBD, she or he may need a different dosage. Specifically, some individuals need a high dosage to control epilepsy, whereas smaller dosages may be sufficient for anxiety. Another factor that consumers should consider before using CBD oil is their weight. When using Epidiolex and in many clinical trials, healthcare professionals calculate a dose per kilogram of body weight. Therefore, individuals who weigh less should take a lower dosage than those who weigh more. Although research data in humans remain limited regarding the effects of taking pure CBD oil, experts suggest that it has relatively low toxicity. In a human physical dependence study, researchers gave participants 1,500 milligrams of CBD every day for 4 weeks. The results indicated that such a high dose was well tolerated without any side reactions. The World Health Organization also reports that consumers usually tolerate CBD well. It's important to note that there are no official guidelines for CBD oil dosage. Some manufacturers are advertising CBD items with unproven medical claims, and the safety and quality of these products can vary. The dosage that consumers take will depend on the method of administration that they are using and the specific CBD item. However, if any adverse reaction is detected, it is strongly recommended to lower your dose. Talk to your doctor about the side effects you are experiencing. In general, CBD is a safe compound. However, there are many inferior quality CBD items produced by unreliable brands. Such products may contain harmful ingredients that can lead to potential problems with health. Another critical issue is the labeling of CBD products, which is frequently inconsistent and unclear, making it confusing for people to know what they are purchasing. Thus, if a consumer wants CBD products to work without unpleasant side effects, it is necessary to buy CBD from reliable and trusted sources. Personal research is recommended before purchasing and using CBD oil. Drug interactions. The human body processes drugs in different ways. In general, CBD can occupy enzymes that the human body uses to process other drugs such as warfarin, HIV antivirals, antiepileptics, and others. When breastfeeding or during pregnancy, a woman shares everything she intakes with her child. Thus, molecules in the mother's bloodstream can be passed to the child's body through the placenta and breast milk. Central nervous system depressants or alcohol may increase the sedation effect of CBD oil. Patients who use other medications that can cause drowsiness should avoid or lower their dosage of CBD oil. Before mixing pharmaceutical drugs and alcohol with CBD, consumers are advised to ask their doctor whether it is safe. Consumers must also consider the dosage in each form of CBD. For example, a capsule of CBD has a specific dosage, but the dosage of CBD oil depends on the volume. Your needs are just as unique as you. Always consult your doctor before experimenting with CBD on yourself or your family. Now, let's take a look at how to give yourself a dose of CBD properly and maintain healthy habits to achieve the best possible results.